Narayana Health City marks landmark achievement with over 1 lakh neurology procedures. Bengaluru, 23rd September 2025, Narayana Health City has crossed a historic milestone of over 1 lakh neurological procedures in 20 years, reinforcing its position as a national leader in advanced brain and neuro care. This achievement reflects 2 decades of cutting-edge treatments, pioneering technology, and unwavering patient trust. From life-threatening seizures to a brain stroke and a rare movement disorder, specialists at Narayana Health City, Bengaluru, have transformed the lives of multiple patients through state-of-the-art neurological care and seamless multidisciplinary teamwork. The first case involved a 21-year-old university student, Miss Deepa, name changed, who arrived with persistent seizures after an initial treatment elsewhere. She was in super-refractory status epilepticus, a condition in which seizures continue beyond 24 hours despite aggressive medication. Over a period of nearly 7 weeks, a coordinated team of neurologists, epileptologists, critical care experts, nurses and neuro-rehab therapists provided intensive treatment, including multiple anaesthetic-coma therapies, anti-seizure medicines and immunotherapy. Against the odds, she gradually regained full consciousness. She is now able to walk unaided and live independently. Seizures lasting more than 5 minutes are a medical emergency. Early recognition and rapid treatment can be life-saving, emphasized Dr. Gopal Krishna Dash, Senior Consultant Epileptologist, Narayana Health City. The second patient, Mr. Rajesh, name changed, aged 50 years, experienced severe upper body dystonia, a movement disorder, endured months of relentless, involuntary backward arching that left him unable to sit or stand comfortably. Oral medications and botulinum toxin injections failed to help. The team recommended deep brain stimulation, DBS, implanting tiny electrodes to correct abnormal brain signals. Within a month of fine-tuning the stimulation, his symptoms had reduced significantly, and he now enjoys a near-normal life. Awareness of DBS for movement disorders remains low, yet its benefits can be dramatic. Its indications are expanding rapidly and deserve wider recognition, noted Dr. Kuldeep Shetty, Consultant Movement Disorders Specialist, Narayana Health City. 1 in every 4 individuals is at a risk of stroke in their entire lifetime, and 1 is every 50
procedures. It's a significant achievement, and I'm glad to be here to share this moment. Also, as an ex-patient, I would say, of Narayana, just to share my story. I was driving one night from Goa to Bangalore. At around 2 o'clock in the morning, I just felt very, very tired, and I found a difficulty in movement. So my family acted very quickly and took me to a hospital, and a scan confirmed that it was a TIA, reversible thing. So I underwent a carotid stenting procedure done by Dr. Uday, a painless procedure. And I learned that with timely treatment and proper follow-up, these symptoms gradually reversed, and I was able to return to my normal life and to music. This experience made it clear to me that a stroke or a TI is a medical emergency, but it is treatable, and it is also preventable if it is caught early. And acting fast really matters. I'd like to thank Dr. Uday, all the nurses and the doctors and the entire team at Narayana Health for the care I received. Their calm and professional approach made it a big difference in how I experienced my treatment and recovery. So to anyone going through similar situations, don't delay seeking help. Early recognition and timely treatment can change the outcome. Recovery is possible and life can go on. So we're back to where we were. Thank you so much.
Hello. Yeah. Now I will stories spanning critical care, advanced imaging, minimally invasive procedures demonstrate.
Head of Neurology. Today is a milestone event for us. Neurological conditions, there are various procedures available, Many people don't know about it, that in neurological conditions there are many treatments available and it can be prevented also. So we have crossed 1 lakh neurological procedures. It includes various procedures like DBS, interventions, headache interventions, EEG, NMG, everything. And I want public to know that few of the neurological conditions, for example, brain stroke, can be prevented and it can be treated also.
And your suggestions come by brain stroke?
Yeah, so main challenges is people don't identify the symptoms. Okay, so that is the main thing. And even because it is a painless condition, they neglect it. And they don't know that it's an emergency, they need to reach a stroke-ready hospital. And the treatment can be given, in some cases, up to 24 hours time window. So this is the main hurdle, reaching the hospital, calling the ambulance, identifying the symptoms. These are the main hurdles in India now. All over India, mechanical thrombectomy, what is required is around 3 lakh procedures, but we are doing only 5,000 procedures all over India every year. All over India, I'm telling. So more awareness is required that neurological conditions are treatable, especially stroke, epilepsy, movement disorder, many things. And we need to identify early and reach a right hospital early. Yeah. So to remember, you should know the mnemonic B fast. B is balance, if they are having balance issue or anything. E for eye vision, either blurred vision or double vision. F for facial asymmetry, like one side of the face goes one side. Arm weakness, A for arm weakness, means if you ask them to lift both hands, one hand will go down. S for speech disturbance, either they stop speaking suddenly or they will have slurring of speech. T is time to rush to stroke-ready hospital.
For the Department of Neurology today, as we have crossed 1 lakh procedures. The procedures mostly that we have covered the stroke interventions, deep brain stimulation, management of complex epilepsy patients, EEG, video EEG, pre-surgical evaluation for epilepsy, and surgical treatment for epilepsy. Epilepsy is a common condition. It is actually a disorder of the brain where a person gets recurrent episodes of unprovoked seizure. In India, roughly about 1.2 crore persons with epilepsy we have, and nearly about 7 to 8 lakhs epilepsy patients they get added up every year. Now the most important thing to note that in India, nearly 30 to 50% of the patients they do not receive proper treatment. That is called treatment gap, and that is more common in rural area as compared to the urban area. Now that is mainly due to the educational gap and the stigma related to the epilepsy. But the good news is that nearly 70 to 80% of the persons with epilepsy, they can be cured by proper medications alone. Nearly 20 to 30% of persons with epilepsy, their epilepsy may not be cured by medications. In these situations, there are other treatment options are available. For example, epilepsy surgery, neuromodulation treatment like vagus nerve stimulation or ketogenic diet or other forms of immunotherapy. So the most important message that we would like to give today is that epilepsy is treatable. Most important thing is that the awareness should be there so that the people should reach to the hospital to receive the proper treatment. Epilepsy is treatable. Nearly 70 to 80% of cases it can be treated by medications, and nearly in 20% of cases it can be treated by other forms of treatment like epilepsy surgery. Thank you.
I would like to highlight on one of the most underutilized treatment in neurology, which is deep brain stimulation. So this is a procedure which is done for a lot of neurological disorders like Parkinson's disease, tremor disorders, and disease which involve twisting in multiple parts of the body called dystonia. So the awareness about availability of this procedure is very minimal. It requires a lot of awareness creating attempts from doctors as well as from the press also, that such procedures are available, and the patients who have these conditions like Parkinson's disease, tremor disorders, dystonic disorders, these all patients, they are going to benefit a lot if they undergo these procedures called deep brain stimulation. So I think it is a very, very underutilized procedure. More and more awareness is required here so that patients can benefit from this. Thank you.
Thank you.